everyone, welcome to the Low Carb Lifestyle Long Weekend Online Summit 2021. My name's Avi Charlton. I'm a GP in Wantirna, a suburb of Melbourne in Victoria, Australia. Let me introduce myself. This is my family. I have two boys. Their name is Jack and Max. They are 12 and 9. This is me in my consultation rooms in Wantirna in a GP clinic. As a general practitioner, I pretty much see anything that comes in, including coughs and colds, women's health, mental health, diabetes, children's health, cancer, weight loss, just about everything. I also have a hobby of running for the last 5 or 6 years. I ran my first marathon in 2019 and I do a bit of trail running. The other picture is me doing a 28-kilometer trail running event called 2 Bays. I did it earlier this year. It took me almost 4 hours with a big mountain to climb. I have 2 dogs. They are Rhodesian Ridgeback. The names are Mambo and Zulu. Zulu comes running with me. Mambo used to. So this talk, I'm not going to go too much into my personal journey about running and weight loss. Last year in 2020, I did a talk for Tracy's Low Carb Lifestyle Long Weekend, which you can still access, and I talked about my own journey. You can find it on Tracy's website or on my own YouTube. I talked about how I got into running, exercise, established as a hobby, and found eating incorporating into my general practice, and I set up my own low carb program to help patients lose weight and gain health. This talk, I'm going to continue talking about what I've learned since then as a GP and recognizing so many myths I used to tell my patients. Since the talk last year, as you know, COVID hit. We went into a pandemic. Victoria went into lockdown for 6 months. There wasn't much to do. There was no social life. I dived into more learning. I did more courses including nutrition, especially when the clinic was quiet. I read many books and I actually listened to it on Audible when I'm driving. We have a farm about 1 hour away on the way to Phillip Island. It's a working farm with cows. So my husband has to work there mainly on weekends. He loves farm jobs. He's obsessed about it. Even in the pandemic, in the Victorian lockdown, we still had to work to maintain the farm. We have cows in our farm grazing on our grass. We have our own chicken to give us eggs. So I would do long drives each weekend to our farm, as well as I kept working as a GP. So you can see in this picture, we have the farm and there's my husband talking to the cows and there's my kids with the chicken and we get lots of eggs. So in my long drive to the farm, I would listen to audio books, including The Big Fat Surprise by Nina Teachow, Lies My Doctor Told Me by Dr. Ken Berry, The Obesity Code by Jason Fung, Why We Get Sick by Dr. Ben Bigman, and Sacred Cows by Diana Rogers. Nina Teachow wrote The Big Fat Surprise, Why butter, meat, and cheese belong in a healthy diet. She described the history of how we've been told to cut back on saturated fat based on a few scientists with big egos and personalities, how there's no real evidence to establish the dietary guidelines. She also described how harmful, how the history of seed oils, such as vegetable oils, canola oils, came about, and it's so harmful to our human body. This book also opened up why the dietary guidelines came about, not because of any real science. I questioned what was taught to me in medical school about saturated fat, cholesterol, and carbohydrates. I also listened to Dr. Ken Berry, Lies My Doctor Told Me, to see what lies I've been telling patients. Surely there's a few that I really should do the research. He is very big on nutrition, and I hope to be just like him, talking about nutrition. Sacred Cow is such a good book compiling how good the nutrition of meat. especially red meat. Also discussed the benefits of regenerative farming, which are actually part of the team. Of course, Jason Fung's The Obesity Code is the must-read. He talks about how calorie in, calorie out method of losing weight doesn't work. People just go into starvation mode and put on more weight out of the diet. How to effectively lose weight? Low carb and intermittent fasting. So I signed up to more nutrition talks offered by Nutrition Network. Diabetes reversal, obesity reversal, nutrition and immune system, LCHF for practical medical applications, prescribing LCHF in clinical practice. So I did lots of learnings. Sometimes the clinic was very quiet, so I did more learning. If you go into YouTube, you can access all sorts of talks from big names in low-carb nutrition, such as Preeta Bruckner, Dr. Paul Mason, Dr. Lucy Burns, Nina T. Schultz, Dr. Ken Berry, Dr. Eric Burke. I also joined a few Facebook groups to talk about low-carb nutrition. This doctors group are so helpful to troubleshoot the treatment of patients. I learned heaps from the latest about low-carb eating from this group of doctors. It's also helpful to see what others around the whole nation is doing. Before Christmas last year, Tracy asked me to join her to set up a group called Carb Melbourne. It was great to connect with local people. We have got a lovely group of admins who have become good friends. We're hoping to support people starting or maintaining this journey. We're not just judgmental and supportive of each other. We're also organizing a few social events to connect people with the same interests. It's an awesome group so far. All this learning has opened me to a great world of information on the link between nutrition and chronic diseases. I am embarrassed to say many of what I used to tell patients is actually not true. Many of what I learned in med school are totally outdated. I'm only 45 and I don't think I'm old. I finished medical in the year 2000 when I was 25 and I've been the GP for just over 15 years. The majority of my time as a doctor, I've been telling patients the wrong information. As Aseem Mahadra quoted David Sackett, half of what you learn in medical school will be shown to be either dead wrong or outdated within 5 years of your graduation. The trouble is, no one knows which half. The most important thing is to learn on your own. Aseem Mahadra is a UK cardiologist promoting a diet avoiding sugar, carbs, and eating more fat, questions the worth of statins. So in this talk, I want to talk about the myths that I used to tell my patients. I'm not going to dive into the evidence behind the myths. I'm a GP, not an epidemiologist. I have read many books. However, the exact details of the studies isn't really going into my head. So I'll produce a list of myths I used to tell my patients. Number 1, the first myth. To lose weight, you have to eat less, move more. This is actually a myth because calorie in, calorie out model doesn't work. Since I've learned that exercise isn't essential for weight loss, since then I have learned that exercise isn't essential for weight loss. Calorie reduction and counting calories isn't the solution. When you count calories, you don't take into account of the quality of the food. How good is the calorie? Is it a good calorie or is it a bad calorie? The truth is, a calorie in carb isn't the same as a calorie in protein or healthy fat. The problem with calorie restriction is you reduce energy and you get tired and you get obsessed with food. You can't stop thinking about food. The body actually shuts down and you go into starvation mode. When you eat normally again, you actually put more weight on. Then you go into a cycle of yo-yo dieting. The more you diet, the more weight you put on. The brain also doesn't function well on calorie-restricted diet. The real method of losing weight should really be improving your hormone profile, especially insulin. In order to reduce insulin, we need to eat the right food that doesn't cause a massive insulin rise. And what food causes insulin rises? Sugar and carbs. The other way to reduce insulin is intermittent fasting. Eat meals and not snacks. Stop grazing. Avoid midnight snacks. So eating high quality food is the key. High quality food includes good quality protein, especially meat, eggs, fish, poultry, and healthy fat. Don't forget most white carbs are actually processed food. It becomes sugar when eaten, and actually it's not real food. The second myth I used to tell my patients is high-fat foods are unhealthy. That's not true. In fact, you have to look at what type of fat and what type of food. The top picture depicts the food high in fat because of the chips were fried in fat. However, the second picture with olive oil, coconut fat, fat in meat, all the foods are extremely high in fat, but these fats are healthy fat. Actually, these fat with lots of saturated fat are extremely healthy. We used to worry about cholesterol. Cholesterol is essential. It's actually very important to have cholesterol in our diet. It is essential and shouldn't be feared. Cholesterol is a waxy substance in your blood. It travels through your blood, helping to build cell membrane, making hormones, bile acids, making nerve sheets. Also, contrary to what we used to believe, it's not the total cholesterol that is bad. What we really should be looking at is a number called triglyceride. If it's high, it's more of a risk to cardiovascular disease. Also, if your HDL, we call it good cholesterol, is low, that's more of a risk of cardiovascular disease. That's not what we used to tell patients. We used to believe that LDL, also known as the bad cholesterol, is the culprit for heart disease. But that's not true. The LDL isn't as much a marker as we originally thought. So it's a bit of a learning curve for me to learn about how to interpret the cholesterol profile. We also have to unlearn that eating fat makes you fat. Eating fat, healthy fat, isn't going to make you fat. Your body needs the fat for brain function. We need to stop demonizing fat. Eating fat doesn't make you fat. I used to tell my patients to avoid eating saturated fat with the fear of increasing the risk of cardiovascular disease. The correlation of what is actually not based on good studies. The third myth is breakfast is the most important meal of the day. Who invented this slogan? Kellogg's, the cereal brand. I've come to learn that we actually don't have to eat non-stop, like every 2 hours. In fact, time-restricted eating or intermittent fasting is a very powerful tool for weight loss and general health. It reduces insulin resistance. The more meals you eat, the more often your insulin has to work. If you snack in between a meal, for example, morning tea, then your insulin has to work again. The more often your insulin works in a day, the more chance you can have insulin resistance. The longer you can go without eating, that is 12 hours at night fasting, then your body can have a chance to reduce insulin and hence burn more fat. This is my favorite diagram to explain how time-restricted eating and intermittent fasting works to lower insulin. Time-restricted eating usually means eating 3 meals a day and no snacks in between. Intermittent fasting means sometimes you can skip some meals. Maybe you can start having breakfast at 10 o'clock or 11 o'clock or 12 o'clock. Maybe you're going to have 2 meals a day, a breakfast at 12 and a dinner at 6, and that will give your body some time to have a rest and your insulin can come down. The fourth myth that I used to tell my patients is low-fat food is actually better, it's preferred. That's not true. So we really should be having full cream milk, full fat cheese, and not low-fat options. I admitted that I used to get a skinny latte with low-fat milk myself. But if you look at the sugar content and the carb content of any low-fat anything, it's actually higher in carbohydrates. As discussed before, there's no evidence that fat is harmful. So what I actually do is I have a teaspoon of cream to go with my coffee in my morning. So I would really recommend full fat options, full fat milk, full fat cheese, and yogurt and sauces. Avoid anything that's low fat. The fifth myth that I used to tell my patients is exercises is essential for weight loss. Whenever I question patients about their weight, whenever they want to bring out weight loss, the first thing they talk about is any plans to start an exercise program or start going for walks. I'm sure exercise has many, many benefits. I myself are very addicted to my running and my workouts. But to tell you the truth, many of my patients don't exercise and successfully lose weight with the dietary changes. You just have to eat the right foods. Exercise has many benefits, including building muscle strength, endurance, and mental health, but it's not essential for weight loss. It will help, but it's not essential. The sixth myth that I used to tell my patients is that vegetable oils are made from vegetables and it's good for you. That's not true. I used to believe vegetable oils are made from vegetables, but they're not. They're made from seeds, lots of manufacturing processes and purifying processes. They are extracted from plants, either with chemical solvent or an oil mill. Then they are purified, refined, and chemically altered. They are often labeled as heart healthy, but these oils actually increases your risk of insulin resistance, and they even increase the risk of cancer. They are easily oxidized. They're not stable. Stay away from seed oils, which includes vegetable oil, canola oil, rice bran oil, sunflower oil, cottonseed oil, margarine. They're highly inflammatory and processed. Okay, what I use for oil is I use coconut oil for stir fry, high heat, roast, and olive oils for dressing. I also use ghee and butter. Also be careful of packaged food with seed oils. For example, I found a mayonnaise made from sunflower oil. A lot of packaged food contains seed oils. Be sure to look at the ingredients to avoid these oils. Avoid takeaway because quite often takeaway is cooked in canola oil or vegetable oil. I try to minimize takeaway and restaurant foods to maybe once a week or even less. The seventh myth that I used to tell my patient is salt is bad for you. We should avoid salt if there's any hypertension. That's actually not true. Dietary salt does not rise blood pressure, and a salt-restricting diet can actually do more harm than good. I just finished reading the book called The Salt Fix by James Diamandis. Nicolantonio. To summarize the book, number one, there's no evidence low salt intake is good for you, and there's no evidence that it lowers blood pressure. Low salt intake can increase heart rate and put strain on your heart. So you shouldn't have a salt-restricted diet. Low salt intake can also increase insulin resistance and subsequently diabetes. What grain is the culprit? It's actually the sugar that can increase high blood pressure. It increases insulin resistance and hence increase the risk of diabetes. Salt is not addictive, however, sugar is. Your body will not eat more salt than you actually need. Your body has a way to excrete the extra salt you consume. It doesn't put strain on your kidneys. The kidney can do wonders. Higher salt intake does not increase blood pressure. What increases blood pressure is a higher body mass index. Your BMI has a stronger correlation to increase blood pressure. Higher salt intake can actually reduce your risk of heart attacks, strokes, infections, and many other diseases. Salt restriction to less than 3 grams a day is very difficult and intolerable to most people. Makes food not tasty at all. Alright, so number 8, the myth that I used to tell my patient is we should avoid meat. It increases your risk of cancer. Does meat increase the risk of cancer? The evidence that it increases your risk of cancer is not true, and meat should not be feared. Why is meat demonized? There is a long history. If you look at the work of Belinda Vetke on this topic, you'll find the history is shocking. It's related to religious ideas of the Seventh-day Adventist Church that eating meat is sinful. Sanitarium and Kellogg's are companies related to Seventh-day Adventist Church. Ultimately, the vegetarian ideas has been coming down to religious beliefs and financial gains. The vegan movement is also pushed by people with vested interests in the big food companies. I'm also amazed by friends who actually do fantastic in their health by eating just meat. Those are carnivores and they are so healthy. So does meat cause cancer? The studies that claim that it's only showing association, not causation. If you look at these two images, meat-eating person, you often think of someone eating hamburgers. If you think of a vegan, maybe someone that looks more like top picture, someone that eats vegetables. In fact, these people actually are more likely to take care of their own health. They would more likely to go to see the doctors more and less likely to be smoking or do other health damaging behaviors. So what do you think, who's more likely to have cancer in the studies? The person that eats more meat, as well as the hamburgers and the chips, or the vegan that is eating vegetables and much more conscious of their health? The 9th myth that I used to tell my patients is you need to eat 2 serves of fruit and 5 serves of veggies every day. Vegetables and fruit aren't essential. There's no evidence to eat 5 serves of fruit and veggies every day. As soon as I ask patients about how they eat, they would say yes, they eat lots of veggies and fruit, and hence their diet is very healthy. But in fact, do we really need vegetables and fruit? Fruit is actually very high in carbs and sugar. It's nature's candy. It should be a sometimes food. The more fruit you eat, there's actually a chance that it can stop you from losing weight, and the fructose can accumulate in your liver, causing fatty liver. What about vegetables? In my opinion, vegetables are good, but not essential for good health. Vegetables often produce anti-nutrients that can harm the animal that comes to eat it. I didn't know about all this until recently. For example, lectins, oxalates, phytic acid. To many people's surprise, in the low-carb community, there are numerous people that have gone carnivore eating only meat and has tremendous health. I still eat vegetables, but I've come to conclude that it's not necessary, it's not essential for good health. Do we need vegetables for fiber? Do we need vegetables to ensure we can open our bowels? The fiber hypothesis is full of flaws. My belief is if you eat carbs, for example, lots of flours like bread and pasta, you will need the vegetables to assist with your bowels. The next myth that I used to tell my patient is keto is dangerous. Keto is harmful, it's inflammatory. That's not true. In fact, people have been confused ketosis with ketoacidosis. During the third trimester of pregnancy and exclusively breastfed babies, these babies are actually in ketosis. The human breast milk is extremely high in fat, and the babies run on ketones. Ketosis is the metabolic state when the body runs on ketones and fat rather than burning glucose. It's totally different from ketoacidosis, which happens in diabetics when the ketones go dangerously high level because of their lack of insulin, and they can get very dehydrated. But ketoacidosis doesn't happen in normal people with functioning pancreas. In fact, these conditions can actually improve on low-carb keto diets. Diabetes, metabolic syndrome, obesity, hypertension, fatty liver, gastroesophageal reflux, gout, epilepsy, migraines, polycystic ovarian syndrome, and some skin condition, including eczema, acne, psoriasis. We could actually improve these conditions and maybe reverse it. There's lots of studies showing that maybe the next group of conditions can be helpful for using low carb and keto. These conditions include Alzheimer's disease, Parkinson's disease, ADHD, autism, lots of mental health conditions including depression, anxiety. Some cancers might be helpful, chronic pain disorders, fibromyalgias, and some autoimmune conditions such as Crohn's disease, ulcerative colitis, and fibromyalgia. Other benefits of low carb or keto: it can improve your sleep. A lot of people will say they sleep so much better. It can stabilize your mood. A lot of people say the mood is more level, more even. Improve cognition and performance. I myself find my mind is so much clearer going on low carb and not eating the sugars. It can control appetite. I don't feel hungry anymore. It can improve digestion. It can boost your immunity. A lot of friends who are on low carb or keto say they hardly get sick, especially in the COVID pandemic. I think this is a very important thing to promote, is we need to improve our metabolic health to improve the immunity so we don't get sick, even if we catch COVID. Reduces inflammation, improve endurance and physical performance. I find my endurance running is so much better now that I have become a fat-adapted athlete. Improve skin, and you have a better muscle tone, increase muscle tone. The next myth that I used to tell my patients, or a lot of normal doctors tell patients, is low carb diet isn't sustainable. I think that's not true. Sure, a lot of patients go in and out of low carb, keto, but there's a lot of people that can sustain this lifestyle. It's not just a diet, it's a lifestyle. I myself find I've been in low carb for about 3 to 4 years. I feel much better. I have less cravings. I have much more energy. For my exercise, I'm fat adapted, which means I burn fat rather than glucose. I train fasted without breakfast. I have endless energy. I have a less need of taking a nap in the afternoon. Sure, sometimes if time permits, I have a nap, but a lot of the times I don't need it. It takes a few months for an athlete to convert from up to a few months, sometimes a few weeks or a few months, to convert from a glucose burner to a fat burner. During that transition phase, it's common to have less energy for physical performance. However, I find that I've turned the corner. I can run longer, I recover faster, and my muscle aches and pains after a long run is much less. So general day to day, I feel like I perform better. My mind is clearer. At work, I used to crave food by mid-morning, and I need a snack in the middle of the morning. Now I've stopped becoming hungry and angry, which my receptionist used to call me I was hangry by mid-morning. I do admit most mornings I do eat a breakfast. Then the next thing I eat is my lunch, and I don't snack in between. I don't usually have an afternoon tea. So after a lunch, then I would eat my dinner after dinner. Sometimes I have a bit of a dessert with dark chocolate. Sometimes I have a yogurt after dinner, or a little bit of berries and cream. But I don't have midnight snacks, and I don't feel hungry. Sometimes when going out to restaurants or social events, I don't worry too much, and I have to enjoy myself. I would have a little bit more carbs. On odd occasions, if I indulge too much, I do find myself going into a carb coma. I feel worse after eating carbs, tummy bloated, lack of energy, and the cravings come back. Hence, when after doing that, I have to quickly go back into my low carb eating after an event like that. So I think I am much better. I feel better for my productivity and for my well-being to continue to low carb. So I don't see why people say low carb isn't sustainable. I find I'm so much better. There are patients who I see that successfully lost weight during low carb and keto. They may slip back to the standard Australian diet with plenty of grains and carbs because sometimes they feel like sometimes it's busy, sometimes they have other stress going on, and they put their weight back on. I think we have to look at the mindset. Is there some stress? Is there sugar addiction? Is it something going on in their mind? Is it a mental health response? Finally, I put together a few points, my final thoughts for this presentation. So after being a low-carb GP for a couple of years, I find that it's a very, very rewarding experience. Number one, I found that reversing diabetes, it's so rewarding. Seeing the numbers go from a diabetic patient to no more diabetes. Sure, some doctors will say that they are diet controlled, but if you check the numbers, they no longer have diabetes. I think that's a tremendously rewarding experience. I had a 70-year-old man. I told him before lockdown last year that he had diabetes, according to the diagnostic criteria. So I told him he has to reduce his carbs. He needs to stop eating his bread, potatoes, pasta. He also incorporated some more physical activities. He did more gardening. He went walking. During the lockdown, I didn't see him for many months. After that, we got a blood test, and he's successfully reversed his diabetes. He's lost weight. He's felt better. And it's so rewarding seeing these cases. Number 2 is polycystic ovarian syndrome can be treated with low-carb diet. And treating these patients is so rewarding because there's a baby at the end. In this case, I have to share our experience. I have a lady, a woman with polycystic ovarian syndrome. She was trying for a baby for about 10 years. She was quite obese, but she actually looked at my picture on my wall about my bowl of my low-carb food. And then she kept thinking about the low-carb food that I recommend. She successfully lost about 10 kilos going low-carb. She lost about 10% of her weight. Her periods start coming back. And she got a baby. She fell pregnant after 10 years of trying. Her older daughter was 11 already, and she fell pregnant. It is so rewarding hearing these stories. Number 3 is what I'm doing is I'm changing views one patient at a time. I see about 30, 40 patients a day. Quite often low-carb diet comes into the discussion. I thought if I can change the views of 5 patients out of 30, I've done very well. I have to reward myself. Quite often patients aren't willing to change, or they've been taught a long time on how to eat. It's very hard to change the views. Maybe we need to tell patients many times before it sinks in. Maybe something needs to happen. Then they realize they need to change. I had a mum, she had a toddler. She told me she got so overweight that she couldn't tie her child's shoelaces. Then she realized she needed to do something. She came in, she talked about healthy eating. She's now lost 16 kilos and she can run and she can exercise with her children. So rewarding. I try to spread the word to other GP communities. I belong to a few non-low-carb GP groups like GP Down Under. Every now and then, especially if I see some publications by my low-carb doctor colleagues, I share it with those community of non-low-carb doctors. I must admit that there's lots of resistance from the larger doctor community. People are set in their own ways and they don't want to relearn or change. Maybe these doctors aren't ready to give up their own carbohydrates. However, the tide is changing. There are a lot of doctors that are supportive, even though they don't call themselves low-carb doctors, or even if they don't go out of their way to do talks on it. I also try to contribute to the dietary guidelines. The Australian dietary guidelines are up for review in 2023. The NHMRC had a survey about a month ago on asking people to contribute. It took me some time to write up my contribution, maybe a couple of nights of writing, but I wrote to them, contributing my little bit, especially about the myths I used to tell my patients that we talked about before. So, my final thought, never stop learning. Always question what you've been told. What was taught to me in med school didn't make sense. I questioned it. I read many books. I looked at YouTube videos. I listened to podcasts. I kept listening, and I'm still listening to audiobooks and still listening to podcasts. I now come to my own conclusion what works for me and my patients. We should always question what we've been told. So there concludes my presentation for the Low Carb Lifestyle Long Weekend that Tracy McBeath has put together with her wonderful work. You are welcome to follow my journey. You can join Low Carb Melbourne. You can watch my YouTube videos. You can follow my journey. I'm very happy for you to share my journey, to share your journey with me. And you can contact me if you have any questions. Thank you for watching. Have a good day.